Hi, everyone. Today I have with me Amy Fishley. Amy is a fellow health promoter and with chronic disease and injury prevention at Public Health. Hi, Amy. Thank you so much for joining us today. Really love having you on.
I'm so happy to be here, Marnie. Thank you for inviting me.
Absolutely. Amy is the co-chair of a group called OPENN, and I wanted to give everyone a little bit more information about what OPENN does, because they're doing some really great work. So Amy, what I'm going to ask you is basically, what is OPENN for anybody who doesn't know? It's an acronym, OPENN, so you can maybe just explain a little bit about that.
Yeah, definitely the double N, because you capture the Niagara that way. So thanks, Marnie. It stands for Overdose Prevention Education Network of Niagara. So OPENN is obviously much easier to digest, but it's a really terrific group. It's such an honor to co-chair this group alongside Glenn Walker from Positive Living. Over 25 agencies, I think, are now at that table. And really, essentially, we were brought together around 2016 to respond to the growing issues around opioids in the Niagara community. Obviously, it's happening everywhere, but in particular, 2016 is when it started for our table. It's a coming together of folks to kind of coordinate and respond to substance issues as a group, right? Share those experiences, share those trends in community, because everybody brings a different lens, right? So Casson is at that table. We have folks from all across the pillars of a good drug strategy. So prevention, harm reduction, treatment, enforcement. And then there's those outliers too that are as equally as important. So those social services, housing, all those kind of foundational elements as well. It's a really, really dynamic, awesome group to be a part of.
It is, isn't it?
It's super powerful.
Yeah, it's just seeing everyone come together, and then you get that opportunity to network afterwards. And I feel like it's really like pulled a lot of the pieces in together so that we understand what's happening, what's available within the community,
Right.
You know, and the police are there, the fire department, like it's all, you get to hear their stories and how they were able to help, and then we can share ours. And it's just been a really good experience being a part of OPENN.
Yeah, and it's really unique in that there can be some conflicting views, but at the end of the day, everybody has the same goal in mind. Like everybody wants to reduce substance harms in community, substance-related harms. They want to improve like the public health and safety of our community. So it's really fantastic that people have that space to feel comfortable and share their mandates, share their perspective. And at the end of the day, how do we best move forward and how do we best collaborate to make that happen?
Yeah, and it's really the way that you chair the meeting is really, it works really, it's very effective. It's one, I always look forward to it when I see it coming up in my schedule, because I know that things are going to get done in this meeting and we're going to make a difference, right? So, and a lot of that has to do with the fact that you and Glenn are both such wonderful chairs for OPENN.
Oh, Marnie, my heart. You can tell though that there's a joy and there's a passion about the work too. Right? I hope that kind of translates.
Absolutely.
Yeah, and really, if you look around that table too, you could probably say the same for any of the folks that are there representing their agencies. I think you and what you bring to the table for Casson, like it's pretty awesome.
Yeah, I think it's the idea of the community, everyone getting together, right, and supporting.
Yeah. And it really does take a community for these kind of complex issues. Yeah.
Yeah. So you are a health promoter at Public Health. Can you share a little bit of what's going on there?
Yeah, so my role is really unique. So I'm specifically substance use prevention. So as we said, it takes a lot of partnership and collaboration to do this kind of work around substances. I work with school health and provide some content expertise around their teaching tools, which are available online, as well as other resources or presentations they do in school or other programming. But we also work with a group of youth called REACT, and they're employed by the region. They do a lot of health messaging related to youth, which one of their areas they focus on is substance use prevention. So I'll work with them too, which I know you have as well, which is super. A really great resource to have, especially knowing that youth use is obviously still an issue. And will be so. Alcohol is still normalized and still the #1 youth drug, right. Which is a good segue into one of the latest projects we're working on. It's very early days, but it's an evidence-informed approach to really uncover what are the best interventions and best practices when it comes to reducing alcohol-related harms? And I stress alcohol because you guys know at Casson, it's still the #1 used drug in Niagara, in Ontario, in Canada, and likely globally. So I'm really pumped for this outcome of this project. It'll be some time, but definitely we'll be pulling in our partners when we have more to share. But yeah, we know it's connected to a multitude of harms, including chronic disease, addiction, cancer, and so much more. So it's an uphill battle with alcohol because of the normalization, especially when it comes to health promotion. You would know this, and behavior change. So yeah, that's the latest and greatest. Super excited.
Yeah, that's awesome. We have noticed a rise in alcohol consumption throughout COVID, so really, really important to have a focus there. I'm so happy that you're doing that. And we will have REACT partnering with us again this year for National Addiction Awareness Week event. So we're really excited to move forward with that, and more coming about that event very soon. So thank you so much for joining me. I love the work that you do. Casson has partnered with public health for a long time. We've always, we have the best meetings. Like, you all should come out and join our meetings that Amy and I have, because we just have so much fun. And I feel like we get a lot of work done when we're together and we can put our two minds together. So thank you so much for joining me for this episode of Pot Shots and Slots. We look forward to watching everything that you're doing in public health. And thank you for what you do.
Thanks so much, Marnie. It's my pleasure.